Hi, everyone. Nice to meet you and welcome to this series of webinar sessions around engaging with Pepfar in COP22. My name is Amanda Banda. I am a global health activist and advocate, an ally to a lot of civil society organizations across the world. So I have technically engaged in the Pepfar process since the beginning when civil society started. That was around 2012. And so I think what I'll be sharing in this series is more a very level, top-down, practical experiences of what we have learned over time, what works, and really how best to navigate this process. It's a process that really is elaborate and very extremely technical and really moves fast. And in my experience, if you're new to this process, sometimes you will think that oftentimes it will be your experience that you think, we're just getting started. We actually haven't started yet. And then before you know it, the process is done. So I think what I will take you through is also a look at, what's really going on along the way, along those key documents that will come your way, along, the presentations, or along everything that you will be experiencing and coming across in this process. So we're going into a section to ground this process in the wider national AIDS response in countries. So we know that the governments in the various countries that we are operating in and working in is the core primary responsible for delivering the HIV response. Of course, the different units or departments, as you may call them, that are really, really carrying out this mandate forward. So the Ministry of Health through the HIV departments or units in different contexts, but also sometimes some governments are really well devolved in terms of, operating at the subnational, provincial level and local government level. Of course, within that context of the national level, you have various donors that are really active. And I think I will show you some of the kind of like breakdown of how much also different donors are bringing to the table so that you get a sense of why Pepfar is key and really critical. So of course, typical in countries where you're operating, you will find Global Fund is part of the HIV response. Of course, Pepfar is one of the biggest funders of the HIV response. And for your information, Pepfar, the US government, also does give resources and money to the Global Fund. That's why they're really, really a critical player. And of course, country level, you have other technical agencies and organizations like WHO, UNAIDS, of course, with different mandates. And I will break it down and go into details because you will need to understand the role of each of these stakeholders as you engage, because yes, it's a Pepfar COP process, but the politics and dynamics really impact and really touch and hinge on all these actors that I will speak about. And the most important part, of course, is civil society, and it's PLHIV, and it's the community, and it's yourselves in the process. So I really just want to emphasize that do not underestimate the power that you have, the power and the capacity and the influence that you have and that you can bring to the table. I think over the series we will discuss with examples, what civil society have done to change the course of direction of the whole entire, Pepfar programs in different contexts and really delivering the real changes and demands that communities have on the ground. You are the experts in this process, so do not be intimidated. I really have to put it out there that the process can feel intimidating, but do not feel intimidated with all the technicalities and the big fancy people that will be in the room with their big titles. They do not know as much as you know. They do not bring as much value to the table as you do because you know exactly what's going on the ground. You know exactly why certain things are working and why certain things are not working. And so your voice matters. Take it seriously, because I think that the rest of the populations will be banking on, what you bring to that table. So take, for example, an Erv budget, right? You will find that the ministries of health in a few countries, South Africa is an exception. The government is actually able to procure ARVs for the majority of its population and less dependent on any of the donors. But for the rest of the countries, it looks like almost sometimes 90% plus of budgets for ARVs are being procured by these funders and donors. And so just to go back to that landscape of all these actors, how they're interacting. So you have the national government maybe with 5% contribution in ARVs, whether it's PrEP, whether it's any of the commodities that you want, but also in terms of funding the actual expansion of service delivery to the populations on the ground. The amount of resources they're bringing to the table is very minimal. And so you will see that there is Global Fund, they're putting some resources, and there is Pepfar putting some resources, and there is all these other actors. And so what often happens in this Pepfar process, you will come across these also very typical scenarios where they will say, okay, here's what Pepfar is bringing to the table. The rest of it, what is government doing, and what is Global Fund, and what is all these other actors bringing to the table. So I've started with grounding you on, there's a national HIV response, there are different actors responding. So it's not just Pepfar responding to this HIV response, it's all these other actors. And so as you come to engage in the COP process, keep in mind that there are other players who are supposed to do other things, and they have responsibilities and roles to play. So if you're talking about, for example, policy, you're not going to ask Pepfar to change a government policy, because then this is the wrong platform. You're going to ask the government, again, through this process, it's possible also to push them through the COP process to change specific policies that will enable expansion of specific interventions, especially key populations where government is always pushing back. So look at it as it's a Pepfar process, but Pepfar is operating in the context of wider other national stakeholders, but also global stakeholders in the HIV response. And so you really have to understand all the roles of these different actors. I will deep dive into that, but then nail down on what Pepfar does, what are they actually responsible for delivering, and what should they be doing. So as you come to the table, you're looking at it from, here's a national response. Government is doing this, Global Fund is doing this, all these other actors are doing this, and this is what Pepfar is doing and should rather be doing. So that now takes me to diving deeper into who is Pepfar. So Pepfar was created as a US government initiative response to the AIDS crisis in the early 2000s. Remember, 2000, 2002, 2003 was really, really devastating with lots of AIDS deaths, with no access to drugs, and many people dying. This was a US government initiative and response to say, as a government, as an American government, we need to do something about this pandemic. And so they created this initiative as a special response to how the American government would really mark its footprint in terms of ending AIDS and really dealing with the pandemic. So precisely it was set up as that, as a Congress in the US passed the initiative into existence. And of course, that also just didn't come on its own. Global Fund came into existence also with the push of civil society saying, the world needs to do more. You need to coordinate and come together and respond to this. And also just keep in mind that also Pepfar just didn't exist because somebody woke up and said, we have to do this. There was a lot of push by civil society then, to push the American government, to do something about it. So you have to see the whole existence and origin of Pepfar as also a result of civil society advocacy. And so Pepfar at the moment is operating in more than 50 countries across the world with different level of programming. And so some very extensive, robust, some very just top line, and some very detailed. It's purely based on the epidemiology and the burden of the diseases in terms of, where are the highest, challenges and gaps. But largest number of the countries, of course, are in sub-Saharan Africa, with a few countries in the Western Hemisphere like Haiti, and then, of course, also a few countries in Central Europe. We have Ukraine, for example, and then, of course, also some countries in the Asian region. So over time, of course, Pepfar has achieved a lot in terms of numbers for specific programs, for expansion, for ART, for example, for prevention. They have achieved a lot for, children and all these specific populations. Pepfar has achieved quite a lot in that sense. So, for example, as of 2020, we had almost about 25.3 million BMMCs, that Pepfar did decline. They attribute 25% or more of the decline of new infections around young girls and adolescents to Pepfar's resources and programming. They do attribute to about 2.8 million new babies born free of HIV because of, Pepfar interventions and programming. More than 50 million people receiving HIV testing as a result of the Pepfar programming and financing. 17.2 million women, children receiving ARVs, and of course the orphans, vulnerable children, and also investments, not just in direct investments as in treatment, but also investments in healthcare workers, lab infrastructure, and a whole lot of other interventions. So that's just a bit of an overview. And really understanding globally where Pepfar fits in and positions itself. When you look at the resource availability and key funding sources for HIV in low and middle income countries, especially in sub-Saharan Africa, you will see that governments are putting in some resources, but often it's not enough. Then we have next to that, the United States, I think, is the biggest funder for the HIV response in terms of bilateral program. And then, Global Fund, you're all very familiar with the Global Fund and you're engaging with the Global Fund, but Global Fund in terms of resources and how much money and resources they're pumping, Pepfar by far exceeds the Global Fund, and that's why it's a very critical and important player. And then, of course, you have other international donors, could be other governments and also other private foundations and entities. What we have seen also in terms of an evolution, so while we have the setup of Pepfar in 2000, there has been a constant increase and stream of funding and flow into the initiative. But as you know, I think globally that there has been challenges as well around global funding for health in general in terms of how much donors are able to pump in and put into the HIV response. And even more so, it gets complicated with COVID-19. I think we have seen also in the past few years now, 2 years, COVID overtaking almost the narrative of, the need to fund health programs. And so I think this is something that we need to be vigilant about. With Pepfar, they have remained steady in terms of funding. But when you look at 2020, for example, we had a slight increase. I think that was due to Pepfar really deciding to put in extra resources, just like the Global Fund had the C19RM additional resources to mitigate the impact of COVID on HIV. We have also seen Pepfar in 2020 increasing slightly what they call the America Rescue Plan, to mitigate also the impact of COVID on HIV responses. But other than that, looking at the projection for 2022, it's actually gone down. It's actually gone down and back to the levels that we had in 2019. So looking at global overall investment since 2003, when it was set up, I think we're looking at Pepfar, the US having invested over $100 billion in the response, and at least for the past 4 years, an average of $7 billion a year. And so that's a lot. And in the slides that you will get, I have also like a detailed breakdown of, how much money per country from Pepfar in comparison also to the other global donors, just so that you get a sense and really able to see why it's critical, why it's important. So now moving on to how does this mechanism work? So this is Pepfar globally. This is who they are. This is what they exist for. This is what they're doing. But then how do they coordinate? How do they operate? So briefly, we have Pepfar in HQ in Washington, DC, of course, with the Office of the Global AIDS Coordinator that's appointed. It's a State Department office, meaning that it's an appointment, of course, a very high-level political appointment that is made to that office to lead the US efforts in the global HIV response. And so usually it's headed by an ambassador. Previously, we had who we called Ambassador Deborah Burks. She left just before COVID to respond to COVID, but that position is currently being refilled. And we know as of now that Dr. John Kengasong of previous African Union CDC is waiting to be confirmed into that position. And hopefully he's the one that we will be engaging with. But in the meantime, of course, there's an interim coordinator that is running the office. So from that level of Congress, of course, we have this OGAC. This is Pepfar, the Office of the Global AIDS Coordinator, Pepfar in Washington, DC. And within Pepfar, Pepfar is mandated to coordinate the global AIDS response. So they are the coordinating body. What that means is that they are working through other US State Departments that you are familiar with, that exist for other development and other purposes in country, to do a lot of other things, but they're coordinating each and every one of them, bringing together, the element of the AIDS response. I would give an example maybe of look at the UN and look at UNAIDS. So UNAIDS is the UN joint program, and they are there to coordinate all the UN agencies response to HIV. So look at PEPFAR in the similar sense that they are coordinating other agencies of the US State Department. Three prominent ones is of course CDC, and we have USAID as well, Department of Defense. We have Peace Corps, yes. I used to get surprised okay, even Peace Corps, but yes, Peace Corps is also there. And of course, the Department of Labor. So these state departments, you will find that at country level, they all fit and fall under the US Embassy. And then within there is then the PEPFAR coordinator who does coordination of all these agencies in terms of the response. And so they all have their own distinct roles and functions within these PEPFAR processes. And I think I would deep dive into that. But it's important to understand that we have PEPFAR at country level, we have PEPFAR at HQ level. And at HQ level, we have all these 5 departments that I mentioned. And it's very important to understand that, because you will need to know at one point who is where in your country leading what, because they do become influential in the process. And at country level, you also have these 5 departments, each one of them with their own distinct roles and mandates. And then under these 5 state departments at country level, they now give money and funding to what you're calling implementing partners at country level. And these implementing partners are now the ones that you know and come across on a regular basis in your work in different countries. I would just give an example of a few, and it's not an exhaustive list, but I'm sure that wherever you're operating and working from, you've come across, for example, FHI 360, you've come across GPIGO, you've come across MSH, Management Sciences for Health, you've come across ITEC, or you've come across PSI, and a whole lot of other, local organizations as well as these international organizations. And then through these, what you're calling implementing partners, filtering down another layer, of course, is community organizations and civil society. So there's also some level of collaboration and implementation going on with local NGOs and local civil society organizations. One of the things that I need to emphasize is then that PEPFAR at country level is not responsible. Like I said, I keep going back to this. There are players. The government is responsible, Global Fund, PEPFAR, other donors, private sector, faith-based organizations. So PEPFAR is not responsible for entirely responding to everything in the country. And I think this is one of the key things to really keep in the background of your mind as you come to this process. Know and understand where is PEPFAR working, because within a country, they have priority districts, what they're calling priority districts. So Take, for example, in Zimbabwe, they are not operating in each and every district. And if they are, it's not at the same level of intervention. So it's going to be very important that before you come to the process to really understand where is Pepfar's priority districts, where are they operating, and what are they exactly doing there. All this information, of course, is available where you can just click country and just scroll down. All that information is amazing. It will show you where are they working, who are they working with, what exactly are they doing. Because often what happens is that civil society will come to the table and say, we want Pepfar to do X, Y, Z. And then because you're not clear, you're not saying where and how and what, then it just becomes, they like that. Let me just put it that way. They like that because then they will say, yes, we are doing that. And you come out excited like, actually, Pepfar is doing everything we said we want them to do. And then when it comes to implementation, you see that there's nothing. So really understanding where Pepfar is working in country, which district, to what level of extent, what investments, with which organizations, and what results are they producing is going to be very critical as you prepare to engage in this process. So maybe let me pause there and just see if there's any questions, comments. Great questions. So yes, in terms of prioritization of districts, in terms of where they will work in country, how do they decide and determine this? They will also look within countries which are the highest, like hotspots, and that's what's going to be the major deciding factor. Sometimes they would divide up the districts in country and say, these are going to be the Global Fund focused districts in this country, and Global Fund will do everything. And these are going to be the Pepfar focused districts in the country, and Pepfar will do everything. And sometimes they're operating in the same districts, and the government is coordinating this, and they're everywhere at the same time. So it's important indeed to just get a sense of where they are. You have like those 5 agencies I mentioned, and then they're putting resources to the implementing partners. And the implementing partners are also, yes, supposed to work and coordinate and collaborate with CBOs and civil society organizations at implementation level on the ground. This is something that Pepfar has also been very vocal in terms of, we need to have local organizations do more and be involved. But in reality, that is not yet quite translating into practice. I think the key main takeaway for me is really understanding the players and the layers. We're going to dive deeper into that, but also civil society voice matters. It's taken seriously. Don't be intimidated. They don't understand what's going on the ground. And they're also using this opportunity to question the Pepfar country team. Ultimately, you're coming to say, no, that's not working, that's not working in XYZ interventions. This is not giving us results. Why are we spending so much money here? This money should go here. We think these are the interventions. And so you need to be speaking to both Pepfar in country level and Pepfar at HQ level in those spaces and saying no, and make sure that Pepfar HQ also hears those no's, because sometimes you will find that they are your biggest allies and supporters. And because civil society have stood their ground and they've said no, the Pepfar HQ is the boss of the country level. So ultimately they will come and back and say, but civil society said this, it makes sense, we agree, that decision is not going. We are going with what civil society have said because they've given us insight. I will discuss more in terms of the other dynamics, but that's my key takeaway. You have Pepfar at country level and the 5 agencies and the implementing partners designing a program and saying, this is what we think should be done with this money. And they're trying to convince the global team and the government and everybody else to buy into that. Are you going to sit around and buy into that? Are you going to influence and change it? So looking forward into the second session of our series today, we're going to touch on the annual planning process of Pepfar. So the process is usually known as the country operational plan. This is the process where Pepfar in all global country level and all the actors are coming together to make decisions in terms of how much money for specific countries, what that money is going to be used for and how, and also really focusing on which geographical locations and populations in countries, and just the models of care and delivery that really work best, to get the best out of the Pepfar investment in that particular context. So this whole process is called as the COP process, and typically it starts towards the end of November with Pepfar in Washington. Remember, I described Pepfar in Washington putting out a huge document known as the COP guidance, where they are now giving specific, instructions and guidance to countries to say, for this year, here's how this process will work. And so don't worry about that, because I will dive deeper into those, documents and what it entails, and also how you can engage and influence each and every one of them. So one of the things also to understand in terms of the spectrum, of course, is like end of November, as I've discussed, and typically it will run up until April. Very intense, everything goes fast, and there's so many things going on at each layer. The earlier you start to engage and get organized and get your issues and demands known, the better. Do not wait until like March or end of February to really say, here's what we want, because things are moving fast, decisions are being made, budgets are being locked, and the harder you go into the process, the more difficult it is, but it doesn't mean that it's impossible. It's still possible up until the very last minute, and I will show you that. So what is Pepfar trying to do? What they're trying basically to figure out is, what is the problem? I'm just going to give an example. We have, high numbers of new infections amongst adolescent girls and young women, or key populations in Kenya or in Uganda. And even within Kenya, we also can say in these districts, it's a problem. So that is the problem. Do we agree? Yes. And I think often when civil society are engaging in Pepfar, we agree. I think as Jerome mentioned, you will agree, and Pepfar will say, yes, we agree, and that's actually what we are working on. And then you say, oh, actually we've won. I mean, they agree this is the problem, and that's not the end. So identifying the problem. This is what Pepfar is trying to do, and you are coming to the table to agree that the problem is indeed the problem. And if what you're seeing they are identifying as the problem is not the real problem, I think this is where you come in and say, but that's not the problem. The real problem behind this problem is X, Y, Z. And so what you're now thinking, this is now you're diagnosing the problem. So you've identified it, but now you're like breaking it down. Why is it a problem? And how is it a problem that, we need to deal with and resolve? So this is where civil society's voices is really most critical, because if you miss this part, you will leave the room and Pepfar will say, yes, prevention, of new infections is a big challenge amongst adolescent girls and young women and key populations. But the reasons why it's a problem, I think maybe that's why you really have a strong opinion and say, and that also touches on the interventions. So Pepfar is trying to figure out the problem. You might agree, you might not. The problem breakdown, I think you need to really spend a lot of time in understanding how they are describing this problem, because those IEPs, very well, like you see them coming into the districts, they're just flying in those vehicles, they're in and out. You are there, the real issues. So you are in the best position to be able to say, here's the problem, and here's why it is a problem, and really breaking it down and diagnosing it. And then what is the strategic objective then? So we agree it's a problem. Why is it a problem? I think this is where the differences begin. Because, for example, the services are not youth friendly, they are not really in community enough for the opening hours, or there are all these issues, because that really touches on the solution that you're going to bring to the table, which is also what Pepfar is trying to figure out in this process. So we have the problem, let's break it down and diagnose it. And then what is then the strategic objective, So maybe the strategic objective in this case is that we as Pepfar in Kenya want to scale up and put an additional, let's say, 100,000, more, young people on PrEP. And so this is again where civil society Pepfar will play the game, and they will say, yes, it's in our priority, it's in our, we want to scale up prep. You're coming there to say one of the solutions is that we want to scale up prep, and they will say, yes, we want to scale up prep. But if you don't look into the numbers, you will find that their idea of scaling up prep is maybe by 20,000, only. And so you're coming to the table and saying, but that 20,000 is not enough. We need to scale up prep, and it needs to scale up to 200,000. And the real objective of you being around that table is to fight that Pepfar changes its decision to scale up prep from 20,000 to 200,000, because you think that's better, that's reasonable, and that's more bold and ambitious. These are the intricate details that you are bringing your voice to the table and being on the lookout for. Here's what Pepfar is trying to do. Here's the problem. Here's the solution. And here is the strategic objective in terms of how we are going to solve that solution in order to scale up prep to 200,000. What's going on in the core process? They will show you here's what implementing partner X and Y are doing. And you really have to question and say, you know what, that doesn't work. What you rather want to do is X, Y, Z. This is the model of care that we want you to implement to reach those populations. And so that's what also is going to be your strategic objective in terms of engaging in this process. And then, of course, ultimately, it's setting the targets. Like I mentioned the example, is it going to be 20,000 more prep, or is it going to be 200,000? What budget, where they budgeted, let's say, 25 million, do we think that's enough, or we think that's not enough money to get us to the ambition that we want? So this is a summary for me of understanding the process in terms of what Pepfar is really trying to do and achieve. They're simply trying to articulate the problem, the reasons behind the problem and why it's a problem. They're trying to figure out what are the solutions and what are the objectives that they're going to implement to sort out those problems. They're trying to decide how much money will it take to sort out those problems, and what targets and indicators of performance should they set for themselves for really doing a good job. That, for me, is a summary of what Pepfar is trying to do. And here's an example, and I think a tip in terms of really also organizing yourself and being strategic in terms of, this sounds like a lot, but I think if you break it down in, here's the problem, here's the problem diagnosis, here's the strategic objective, and here's the approach or solution, and here's the monitoring indicators, I think you can more or less break it down into the goals and the priority for the country. What are the goals and priority of the country? What is Pepfar saying the goals and the priority for the country for that resource envelope are? So you are there to say, we agree with these priorities or not. And so as Pepfar comes up with their own priorities, you need to come up with your own priorities for the country, and we will deep dive into how. And then, so the priorities, the problems, the approaches, the hows and the solutions, as well as, what strategies to reach those strategic objectives, you need to also to say, this is how, this is the solution. That's why you're proposing to do this, but we think this is what you should do rather, to get to that solution, because we know what works, we see what works. And then where the problem, priorities, what solutions, what approaches, what interventions, where. Remember, I highlighted the fact that Pepfar prioritizes in districts. Is it the same problem? So, for example, we've seen PrEP being scaled up well in some districts and not others. So if you go to the core process, you will see Pepfar saying PrEP scale up is a priority, but you will say, yes, it's a priority, we agree, but we want rather Pepfar to expand PrEP scale up in 5 districts, and you name them, and you also say by such much numbers. That's what you're coming to the table to say. So it's about the where and who will be prioritized, and it's about now the targets by 20,000, by these 5 districts, by this. And then you also looking at the budget, because sometimes they're very sneaky. They will say yes, 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 but then you find that the budget for last year for scale up, for let's say putting 200,000 people on PrEP, maybe it was like 2 million. And you find that they're saying we are going to scale up and expand, but the budget is 2 million. Logically, you should question, like, how is that going to happen? Like realistically. So you are also there then to say, but is the money enough? And can you give us a breakdown of how you're going to expand with the same amount of resources, because if that's not possible, we also want you to increase on the budget. So on those 5 points, I just want to pause a little bit. I always give this example of water. Like, I'm thirsty, I want a cake. Like, get this. You will go to Pepfar and say, I'm thirsty. They will give you a drink and the process will be over. And you'll be like, but what happened? That's not the drink I wanted. You really need to be very specific. I want bottled water. It has to be sparkling. It has to be at room temperature. It has to be 250 milliliters. Otherwise, they will bring you a cup of tea and they say, we gave you a drink. We agreed you were thirsty. That's it, And in the same way, I also always give a cake ingredient because I like baking. And trust me, when you bake, you can try to bake a chocolate cake with 1 egg or 5 eggs and like play around with different ingredients. You will get different results. And I always emphasize to civil society, get your ingredients right. Like, if you want to bake your perfect cake, like this model, this solution that you're saying that it entails 2 eggs, you have to put 50 grams of sugar, and there has to be so much butter. It just has to be right to get the result and the taste that you want. So you really have to have that level of detail and precision when you're coming to engaging with Pepfar, because what we have seen, I will give you an example. Psychosocial support in Zimbabwe, they were like, it's not working. We're having young girls and women and boys dropping out of care because they're being cancelled by older people. And young people said, we want you, Pepfar, to hire young people, train them as peers to do the counseling, and we want them to be 2 per district. And you see the level of detail. Because if you just say, we want young people to be peer counselors, they will say yes. And then in their budget, they will put 20 for the whole country. So you really have to say, we want peer young people to be counselors because we're seeing retention is a problem. We have psychosocial challenges among young people. That's why viral load is dropping. That's why retention is dropping. They can also do a lot to promote PrEP and all these things. And so for what we have seen, what works in what we are implementing, what we're seeing on the ground, I think we need 2 of these people per district and they need to be paid. And so that is a very clear ingredient to the cake. So just to wrap up, that's what Pepfar is trying to do through this COP process from end of November to roughly around mid-April, end of March. So just the top line overview for today in terms of the steps of how they do that is through the draft COP guidance. This is the document that I mentioned comes out towards the end of the year. Normally in November, mid-November, they release it. It's getting longer and longer. At the moment, it's like 700 pages, but don't worry, like they are global civil society that are really diving in and dissecting it. So I think I will speak about that as well. That's the first layer of engagement. The second step in the process is the planning letters. This actually is going out right now as I speak. Some countries have already received the planning letters. These are letters, again, coming from Pepfar, Washington. Remember, OGAG, sending those letters to their Pepfar country teams in countries and to copying national governments and all the stakeholders, including civil society. It's just a first kind of like entry into, here's how much money you have, here's what we think. And so again, this is an opportunity for young people to engage. And then next to that, what you'd be expecting actually in the first week of February, Pepfar teams will send invitations to civil society to invite you to be part of the in-country Pepfar planning retreat. So this can be between 2 days to 4 days to more, to begin to unpack the planning letter and to begin to discuss as a country, as stakeholders, how are we going to move forward with this COP planning process at country level. It's an opportunity to say, what are the expectations? And also, are the budgets enough? And like, just how will this process move forward? So the in-country planning retreat is a key milestone. By the time you go to the regional planning, you are almost like in the middle of defending them and already clear on what Pepfar is agreeing with and not, and what are still the contentious issues. And from the regional planning meetings, there's another process. Usually it's going to be like a follow-up 1 day or half a day meeting where the COP is going to be approved per country. So the COP approval process is where this is now approved. After that, they start writing the actual document now and putting it down. And this is called the Country Strategic Direction Summary. In brief, we call it the SDS. And then, of course, you have the after the final SDSs are submitted, then it goes back to the US government, Congress, and those things are approved. These documents will be finalized around April, May time. It goes back to Congress for the appropriation of the budgets and everything that they do. And they release the budget for implementation in October. So beginning 1st of October is when they start implementing. So do not be discouraged. Sometimes you'll be like, oh, but we just discussed this and we agreed and we don't see it happening yet. So whatever is going to be discussed and agreed by April, May, implementation starts actually in April of that year. So just so that you know. And then sometimes civil society think this is the end, but I think you will now have to have a role in monitoring the implementation, because only through the monitoring of the implementation will you now come to the next process prepared. Because then you can come back to the next process and say, oh, but you didn't do this and you didn't do this as we had agreed. And also note that in those implementation process, there are quarterly meetings that are happening at country level where data is going to be presented. I mean, not major decisions are made, but I think that there's room, if things are not going in the right course of direction, to say, let's course correct. We are not moving in the right direction, or maybe this is no longer relevant. So that's just a top line overview of the key milestones of what you should be expecting to be coming up in the next few weeks and months. I will unpack each process in terms of how you can engage, how to best position yourself, how to win throughout all those processes, and really also coordinate and collaborate with other civil society organizations. So we are just going to do a quick dive through the actors that are involved around the COP process, so that as you get into the process, you are very familiar with who's going to be around the table, and also how you can best engage them and use them, to achieve your objectives and win your demands. So remember, when I gave you the overview of the structure of the Pepfar coordination, how they organize, I mentioned the Pepfar ambassador. And I mentioned that I think incoming will be Dr. John Kengasong this year. So we really have to maximize engaging with him this year, because it's going to be very new. But we have found this position very influential in this process, and here's why. Where civil society failed to convince Pepfar country teams and coordinators and the whole 5 agencies, where we failed to convince governments that what we're pushing for needs to be done, like as a last resort, and we're really feeling this is very important, this needs to be done, we always reached out to the ambassador in an email. She's very accessible. I hope that Dr. John Kengasong is going to be the same. And even the interim one, Angeli is her name, very accessible. We will share the email addresses. Where you feel you're being undermined, you're being overlooked, you're being ignored, do not wait. Immediately send an email and say, we are not happy with what's going on in Burundi's discussion. We are concerned about X, Y, Z. Civil society, we have raised these things. We think it's valid. Here's our evidence. Here's our data. We really want this decision to be changed. They can be very instrumental and key. And sometimes they have halted the whole process and say, to Pepfar teams, go back to the drawing board. Even if you're going to take 2 days, I'm not proceeding with this conversation until you give me answers to the questions that civil society have raised. Very important that you understand the power of the Pepfar coordinator, override decisions, to really hold Pepfar teams to account, to challenge governments. And so that is a powerful position that we often run to as a last resort. And then next to that, I described the Pepfar H-Quarter team. So being led by this ambassador, of course. For each country, there will be what you're calling a country chair. This is a very senior person in Washington, D.C. They have other positions and other roles and functions within Pepfar, but for the sake of the COP process, they are assigned to lead the negotiations and the discussions and take the COP process through for South Africa, for Burundi. So there will be one specific person called the chair. You will see them immediately. You will notice them because from the country to the regional, all these meetings, they will be facilitating the meetings. So very important as well, because they are managing the discussions. Very important. They speak fast. They're just trying to keep time. As a meeting manager, you're trying to meet time. You're trying to close and just move on to the next thing. So when you're in the participation of this process, you're feeling ignored, we don't know what you're talking about, we do not understand, can you go back? You can actually say, Chair, can we pause? We don't understand, we don't agree this. So the chair should do that. And we have done it so many times. We have met with the chairs, sometimes an hour before, sometimes in between meetings, we will say, let's pause, let's break away. We're going to have to resolve and negotiate this, and then we come back to the drawing board. That should be your first point before you go to the ambassador, because often the ambassador will call the chair and say, I got this, can you respond? And then they will say, oh, but civil society didn't raise it. So don't run to the ambassador until you've flagged it with the chair and they are non-responsive, and then you go to the ambassador. What I found is next to the chair, like in any other meeting, there will be the chair's helper. And this position is called PPM, very influential as well. Sometimes they can be allies because where the chair is very, they can be very proud. They can just be very difficult. Sometimes you will get to the chair through the PPM, this other person, and it will be there on the agenda that this is the PPM for this meeting. You can use them as well to say, but we are not happy. What about, can you, create time, And behind the chair, behind all these people, remember the agency leads from USID, people from HQ are there. They're also trying to understand, like I said, the program. And so use them, get them to understand your side of things so that they can say to the country teams, civil society are making a lot more sense in this room, than you guys. You really want to influence them so that they see things from how you're seeing it, so that they also can ask the right questions to their country teams. So really understand these, the chair, the ambassador, the PPM, and the whole technical team. You will see it on the agenda, who's present. They will list and they will say their Pepfar HQ, their USID, CDC HQ, and then there will be the country teams as well. So that's about the HQ. And again, at the country level, you will see the same layer. So at the country level is the Pepfar country coordinator who's leading the process. And what we have learned, just because they are the Pepfar country coordinator doesn't mean they're the most powerful in the room. You need to understand and study the environment. But some of you've been engaging with Pepfar also for a long time. You know that your Pepfar coordinator is not strong. There's always that person, that one person who tells the Pepfar coordinator what to do, and that they always listen. You really need to understand and study this and know that this Pepfar coordinator is just going to say no because he or she is afraid of so and so. And you will see it in the room and in the discussions that there's that certain person who, when they speak up and they say yes or no, things move and everybody agrees. Target those people, the technical teams. You know that you have the key populations like specialists in Pepfar programs. Get to know them. Who are those people? Have you engaged with them also and lobbied them and make sure that they're understanding your issues so that as you bring them in the table, they really can understand the lens of what you're trying to say, because sometimes they want to play you and say, we don't understand your question. What exactly are you trying to say? And then you're just intimidated and then you just disappear in the process. So understand all these layers, the technical teams behind Pepfar and the power dynamics, who really is in charge. And then the ministries of health. This is Pepfar money and you are there to influence Pepfar. There are some things that they have to buy into and endorse, but there are some things that you don't want them to delay. There are things like implementation of certain things is delaying because the Ministry of Health has not put a policy together to get that done. And so the Ministry of Health is not here to put money. This is Pepfar money. They have their own money that they are using to implement programs, but I think it's about what is the Ministry of Health blocking in this process that is really standing in the way of what you guys need to get done and expanded? Some ministries of health, they're really very much like regressive in terms of policies, in terms of, certain models of care. They want to centralize things. When you're saying, let's get this down into the community, let's get ARVs distributed in communities, you're going to reach a better, reach of people. They're very reluctant. So in your engagement in the Pepfar process, as much as your Ministry of Health is not your target, they are a very critical, important stakeholder that you also have to navigate and manage and influence in a way that they are not blocking your ultimate goal. Because you don't want to be in a situation in the room where you're asking for PrEP expansion for key populations and the Ministry of Health is saying, no, we are doing that enough and there is enough of this and that and that. But again, don't let the Ministries of Health intimidate you, because in previous experiences, we've seen sometimes ministries of health saying outright to civil society, like, just keep quiet, shut up, you're distracting these meetings, and we don't want you to be speaking up and raising your hands. And so they really begin to monitor and police, and they will tell you that we will see you when you come back to the country. And really intimidating tactics they play. And what you should know is that the Ministries of Health's role and power diminishes in the presence of Pepfar. So use that to your advantage in terms of getting Pepfar to hear you. But you also, of course, have to be creative in how you manage the situation, because, they can be very destructive indeed, sometimes really threatening civil society, because they also don't want to be exposed. So I've mentioned Global Fund, UNAIDS, WHO. UNAIDS is going to be your ally on key population and human rights issues. Where you're getting blockages from government, I think you need to use them as an ally to push, for certain things. And they can also sometimes be a generally good ally to the civil society issues and demands. So get them on your side, make sure they understand the issues of the young people. Global Fund, it's very much about alignment. What you often see is Global Fund saying, oh, we are doing so much for adolescent young girls and young women, we have this much money. And Pepfar will say, because Global Fund is not doing this, Pepfar, we're not going to do that. And then you find that, no, but what Global Fund is doing is not enough. And so your Global Fund country portfolio manager will be in the room. They are part of the conversations. They are asked to present the Global Fund program and overview in the process. Make sure that for anything that you're going to demand from Pepfar, you have a good sense of what is Global Fund doing, because you don't want to leave the room with Pepfar saying Global Fund is going to do this, and Global Fund says, no, we are going to wait for the next funding request to decide. And WHO is simply critical, I think, when it comes to policies, like ensuring that, we understand the technical parts and aspects of the policies. And for UNAIDS, for WHO, for Global Fund, there will be Geneva-based people in the room, and there will also be country-based people in the room. I think I spoke about implementing partners earlier, so I'm not going to put much focus on implementing partners, but get to know who's implementing the program, how are they doing, what models of care, what strategies, and really where is Pepfar working with which implementing partners, what are they doing. The biggest issue around implementing partners is performance. So you will find that FHI is doing a very good job on reaching key populations. GPIGO or PSI is not. They have the same amount of money. And sometimes FHI is doing it for $300 less than the other organization. What are the issues here? What are the dynamics? So really understanding the implementing partners, especially in the models of care, and also ensuring the question that Michael raised on engaging with CBOs and communities in implementation and designing those solutions is going to be very key as well in this process. So I think those are overall the main players. And the last one that I want to focus on, of course, is civil society. It's going to be you. So broadly, civil society are also coming to the process very organized. And it's about how can you navigate that space of civil society as well? Because I also know I've followed this process since 2012. Civil society, navigating civil society sometimes can be our worst enemies in terms of we are not organized, sometimes we are excluding and not really engaging others well enough. So simply put, for civil society, I think in terms of coordination, we have what we're calling a network of civil society organizations engaging and mobilizing, coordinating Pepfar engagement globally known as Pepfar Watch. It's led by HealthGap. Important to understand that PEPFAR actually requires official participation of civil society representatives. There's 4 of them. We will share details in terms of who's in the room in the specific conversations. I'm saying this because the dynamics have changed. Previously, when we speak about the regional management meetings, we used to meet in Johannesburg for 2-3 weeks. And so when I say 4 people, these are the people that were selected, paid for by PEPFAR to be in those spaces. But now the process is virtual. It's becoming more, at least, open. I think the key is civil society as young people. You need to identify and plug in at country level who's coordinating PEPFAR engagement process, because there will be a liaison person among civil society that PEPFAR is sending all the information to. Within that, as civil society, as young people, to position yourself and make your voice strong. Like, these are the priorities, and do your own homework as young people. Consult widely with other young people, because you also don't want to come to the table as a representative of young people only speaking for yourself when you haven't really consulted other young people to find out what are the real issues, what are the real needs. So civil society at country level will always develop what we call a checklist. I will share these tools. This is something that also Pepfar Watch has developed as a tool. And in addition to that, there are some countries, for example, Uganda, Kenya, South Africa, I think Mozambique has started to do this as well, Zimbabwe. They're having what you're calling a People's Corp. This is a consolidation, again, led by Pepfar Watch and other global civil society partners supporting in this process to compile in writing, here's a list of what civil society thinks are priorities and what Pepfar should do. But the key thing to understand is you don't want to wait to plug in. You really need to start as soon as possible to network, to find out who's leading this process at country level. Sign up for all the meetings, be present and push. And if you don't know, reach out to the Pepfar coordinator as well at country level to say, we want to engage and participate in this process, but we don't know how, because the Pepfar coordinator also has been mandated to follow a systematic process of how they will engage with civil society. And they are also supposed to answer specific questions to Pepfar HQ, like, did you consult civil society? Yes or no? How? Did civil society are supposed to put their feedback in writing and their thoughts and comments and reflections? Did Pepfar country coordinator respond? Word for word, you are entitled to a written response. So don't be fooled. And Pepfar coordinator said, oh, but we responded to you in that meeting. We told you we were going to do X, Y, Z. Put things in writing from the word go, even within that civil society network. The civil society can be bullying to each other as well. And I think you also need to take your stand and position yourself and really stand tall and strong and say, these are the priorities of young people. And that validity or leverage comes the more you have consulted. And so I think that I've spoken about the People's Corp document. Where this is not done, there's tools in terms of how you can organize your checklist and your demands. There's the Pepfar Watch platform where details and more information and intel is shared. Civil society tends to have WhatsApp groups in countries around this process. Plug in and join. We have all this background information. We know the process is starting. How now do you prepare in terms of developing and framing your civil society asks and demands? So we spoke about already the what, the why, and how you're bringing in now data and evidence. We will touch about this as well. And also really understanding, very important, as you're preparing to engage in the process, really understanding what are the other stakeholders' position on the issue that you're going to bring, so that you're really aware. Remember, this is advocacy in action. So we're not taking off our advocacy hats, but we are really bringing in all the knowledge we have about advocacy, is that you go to your opponent really already having an understanding of, if I say this, they will say that. And also remember all the stakeholders that I spoke about that are in the room. As you're going to Pepfar to demand a specific issue that you want them to change, you really need to have a good understanding of what is Pepfar's own position. What are they thinking about what you want? And you also need to understand what is the Ministry of Health thinking. Are they going to agree with you? Are they going to also oppose you? What is the Global Fund thinking? What is WHO? What is UNAIDS thinking? Are they going to support you or oppose you? So I think them opposing you shouldn't scare you and shouldn't be a threat and should not be something that should stop you from still pushing ahead, especially if you feel very convinced as young people, as civil society, that this is what we want and it's the right thing to do. So regardless of that opposition and what others may think, it should not still stop you from pressing on for what you want, because that's the likely situation that you will find yourselves, that often nobody else is going to agree and will support, but you will have to be very bold in terms of making those demands and really pushing for it. So very important that even if they don't agree, but that you already understand that if we are going to ask for PrEP expansion for, let's say, 70,000 more adolescent young girls and young women and key populations in 5 districts in Uganda, most likely the Ministry of Health is going to push back because they think it's not feasible, or they think they're doing enough, or Pepfar is going to say, no, that's too much. We already have, sufficient numbers. You really need to understand all those nuances, because then you come also very prepared with how you're going to argue your case and defend yourself. So very important also in part of the preparation, and like as you're really thinking of framing your civil society priority and demand, to really, really, really think about data. Very important. I cannot emphasize this enough. You will succeed to influence Pepfar without data, but your chances are very minimal, and it's going to be a challenging process. So really, really, really understand Pepfar's own data. We're going to talk about it. Pepfar is very good at collecting data, analyzing it, and digesting it. And for the whole COP process, it's a headache. What you will see from day one until the end is like a million slides of different data in different graphs and graphics, and like presented in all sorts of different ways and colors. So you really need to understand your Pepfar data. Are they identifying the reasons why programs are not doing well good enough in the way that you also agree? So you have that Pepfar data, and throughout the process, actually, before you even begin, they should be already sharing all this data ahead and in advance. There is what you call a data pack. Sometimes it comes in an Excel format with lots and lots of different data. Don't let this also intimidate you. There's a lot of global partners that are willing and available to support you to digest that. So you will have, for example, ART expansion, you will have maybe viral load, you will have something on PrEP, you will have something on AGYW or DREAMS, or all these programs in terms of how they are performing, and they will be presenting from different lenses. And so very important to know that sometimes they will not present everything that you need to know. So you might have questions like, but I want to know this, but it hasn't been shared. Don't be shy to ask them. It just gives them a little bit more sleepless nights, and it's okay to just have them not sleep for the night while they go and dig up for that data that you asked for, because they surely have it. It's just that you're giving them extra work to go and dig for it, but they surely have it somewhere. So in addition to Pepfar's own data, we are looking at you as civil society also coming to the table with your own data. And this data, you will have it from community-led monitoring. For those of you that are involved, engaging in community-led monitoring, very important that you bring what you're finding from those initiatives and activities into the process, because that is very valuable. But also, in addition to that, I think there's other anecdotal and other qualitative data you might have had along the year as part of your activities, maybe focus group interviews with specific populations discussing specific problems. That information that you have is very valuable in terms of feeding into and engaging in the processes, in terms of what really is meaningful to really unpack the problems. So of course you might have had interviews, but also you are often at the facilities and the clinics. You are observing what's going on, and do not underestimate that knowledge that you have in terms of I'm always at these facilities. I've seen this, I've seen that, and it's not right. And I think it should be done like this. You're also speaking a lot to clients and the service users. You're also speaking a lot to the healthcare workers, but you're also using the services from a user perspective. You know what's working and what's not. So all of that, you need to find ways of packaging it and bringing it to the table as you really also use it to support your specific demands. You also, some of you are very good visually in terms of really collecting testimonies and stories and making like write-ups of very impactful stories, like this is a young person or this is a KP, this is what happened and they couldn't access this service because of, this. Bring it all in together to help you shape what the problem is, why is it a problem, and to what magnitude, and what are the solutions, and exactly what do you want Pepfar to do. So I don't know if you're like me. I often have had these experiences when I'm in a foreign country and I'm speaking to people and I'm just like interacting, in community. I'm just going about my day and people are talking to me and they're saying things and I'm just like, yeah, and just smiling and just pretending like I've understood and I've heard, and we smile and we wave and it's like we have communicated. But deep down there was no communication. I might have some sense of an idea of what they were asking or telling me, but clearly, I really didn't understand. There was nothing there. So what we figured out was, Pepfar has a way of, putting things in a way that if you speak the language, it's like if you speak the language and you understand it, you're more likely going to be heard than if you try to communicate in your own language. So we've learned over time that, putting things in what we call Pepfar language actually just helps us to move things closer and get what we want out of the process actually much better. So what do I mean by this? I think we've learned that Pepfar wants you to be very clear. What is your civil society priority? What are your top 10 or 15 hardcore things that we don't want to compromise on and we don't want to come out of the process without? Number two, you really need to understand what is Pepfar currently saying they want to do or they are already doing about this issue. You will look into the Pepfar COP guidance. We will go through this document together. You will look to find what language is it saying generally about that particular issue that you're concerned about. Take, for example, the vaginal ring. You want to know, what does the COP guidance say about it? And you will find out that actually the COP guidance is supportive of rolling out the vaginal ring. And you think that the issue, because one of the reasons why you still have high infection rates among young girls and women is because of the lack of combination prevention tools available and accessible. So you have your problem, you have your issue, you have the reason why, you have a solution. And so you would now want to go to the COP guidance and say, what is it saying about the vaginal ring? And then in addition to that, you want to go to the country planning letter. We will discuss this as well. You want to find out what is it saying. Is Pepfar in that country planning letter also prioritizing this? Yes or no? And then you want to go back to the previous COP documents. We will show you these as well. And you also want to find out, what does Pepfar say about the vaginal ring? Is it something that last year it was discussed and they maybe didn't reach an agreement? Or is it something that they said they were going to do, but maybe they are doing it, but now we're saying that it's not enough. We want this year to ask them to do more. So you have all these documents plus Pepfar's own data that I've already referred to. You want to see Pepfar's data. What is it saying? The COP guidance, the planning letters, the previous COP guidance, the previous SDS document for the country. What is it saying about that vaginal ring issue? And then as civil society, you also add, what are the gaps in the current practices, that we are seeing as civil society, and then what are the solutions that you're asking for? So in terms of solutions, I think we've spoken this over and over, what targets, you really need to name it. So your solution could be that we want to see Pepfar expand the vaginal ring to 20,000 more AGYW in 5 districts in Burundi. That's going to be very specific, and that you want this amount of budget and the details that you want. Now, that is putting things in a very clear, precise demand that is going to be impossible for Pepfar to ignore. And also, it's going to make it easy for them to respond, because in their response, and remember, as you bring these demands and issues to them, they're supposed to give you a word by word written response. So taking this example that I've given you, Pepfar is supposed to come back and say, in COP22, Pepfar intends or plans to roll out the vaginal ring in Burundi. But if you haven't been very precise, you will think that you have won, but you will find that you have not won, because they will say, we are only going to do a pilot maybe for 2 sites and maybe targeting 2,000 women. And then that's not what you want. And so we often came out disappointed, and we felt like Pepfar just played us. So what I've just shared is something that really helps you to really also track. And as they respond, you can also argue and say, yes, but we heard you, but this is not what we want. And you have that wiggle room to keep going back and forth. They should be putting everything in writing. You put it in writing, they respond in writing, you're negotiating in the process, you're talking, you're discussing in the meetings. They're supposed to document their responses, and you're supposed to confirm that, yes, this is what you said. And they're supposed to confirm and put it in writing, because it does become very handy as you're going more and more in and out of the negotiation. The other point that I want to highlight is, what is your priority? What is your objective? What are the targets? What budget? What models of care? So I have an example here, just to show you one of the demands that was made in Zimbabwe. This was, I think, COP 2020, where civil society were demanding. We're concerned about the expansion of viral load amongst the general people living with HIV population was very low. I think it was about 44%, and civil society were demanding to have it expanded to 74% national target. So of course they made the demand, and in making the demand, you giving a lot of background context and really making a narrative very short. I would summarize it maybe per demand, not more than 1 page. Just here's background, here's data, here's what we know, and here's what we're asking for. You're using already existing data. And so it's easy then for you also to know whether Pepfar has said yes or not. Because if they just said, yes, we will expand viral load without giving you the baseline and the actual specific targets, it's not clear whether you've won or not. And so in addition to just wording it like that, because that's a very specific civil society priority, but civil society went further because they know why this is not the case. They went further to digest and really think, what is stopping this to happen? Is it because there's no viral load test kits? Is it because there's no human resources for help in the lab, like the lab technicians to test? And they said, yes, there's no people to test. That's why even if you have the test kits, nobody's doing the testing. That's why the numbers are low. And they also found out that even when there's enough human resources to test, the results are not getting back to the clients. They found out that there was a problem with transportation of the samples. They found out that the system, the online system that is communicating between the facility and the lab is not working properly. They found out so many things. So what they did is, beyond asking, we want you to expand viral load from 44% to 74%, they broke it down. I was there involved in this lobby and advocacy, and it gave Pepfar a headache. And how did we win it? We raised it in the room. We said, this is what we want. We presented it. And they were like, yes, it's a priority. But we said, we're not convinced that it's a priority. Can you show us a breakdown? And then they were like just brushing us off, like I said, and like they just want to move into the agenda. And we said, no. And they said, no, but we don't have time for this. We've just explained to you that this is going to be done. But we said, but you're not giving us the breakdown. So what did we do? We said, okay, fine. We want to ask for an extraordinary meeting within these meetings. Can you create time on your agenda so that we discuss it in detail? And so they agreed to meet us at 8 p.m. And trust me, we were in a meeting with them until 1 or 2 o'clock in the morning, because we were not giving up. They were giving us this and we were like, no, this needs to be like this. And then they were like, but we've put so much money for the budget. And we said, that's not enough. And then they said, oh, but Global Fund is going to do it. And we said, where is the evidence and the confirmation that Global Fund is going to do it? And so the following morning, they delayed the other agenda items, and they put this issue back, and they said, okay, as Pepfar, we discussed, and this is the compromise we are going to reach. Is that favorable for civil society? So we looked at the numbers. I think we looked at the budget, and we said, okay, that's realistic. We can compromise on that. Throughout this process, the Ministry of Health knew that this is a priority, and trust me, behind the scenes, as we were having these screaming matches with Pepfar, Ministry of Health people would come and hug us and say, thank you so much. We cannot bring that issue up, but really thank you, civil society, for fighting for us. And like, really, you guys are really pushing it, but we're like, but why are you silent in the room? It's like, we're looking like the bad ones. So remember, this is the politics and the dynamics. Sometimes you're fighting for things. Government might agree with you, but government sometimes will not say things in front of Pepfar because they're getting money. So you really have to be aware of those dynamics. And so remember, you have allies in the room, you have UNAIDS. Sometimes you can go and speak to the UNAIDS country coordinator and say, can you please support us on this, and just speak up. Like, when I look back and I'm like, we now have this expansion of viral load in Zimbabwe. If civil society did not fight hard for it, where would that expansion look like, and where will it be? So this is the power of real action of civil society. You really have to understand all these politics playing out in the room to be able to make your demand and win. So now you have these priorities, then what? We're just going to take a detour a little bit, a very short one, and just get us back into the advocacy mode. Because remember, in advocacy, you have your goal, your objective. So we have defined that in the sense of our civil society priority. Our target is Pepfar. But we know Pepfar is a large institution. So who within Pepfar, who within this process is going to give us what we want? And I think that's what we want to dive in a little bit more. So I mentioned all the stakeholders, from the ambassador to the chair to the PPMs to the Pepfar coordinator to CDC to USID to Global Fund, the government, to UNAIDS, to WHO, to all these players in the room, but also to other civil society, because remember, other civil society will also have to support you. It's one thing you being there on your own and saying, I want this to be achieved. And the rest of the civil society, when you're talking in the room, they are quiet and they just rolling their eyes and they want to move on. But also making sure that you have the support so that when you raise your points, other civil society are also saying, we agree, we are not moving on until this is, there. So really what we want to touch briefly is on the power, and it's just on the power mapping and really understanding the actors in the room, really targeting, like, who, if I'm asking for PrEP expansion in Burundi for, an addition of 50,000, PrEP rollout, who really should, give us this demand and respond to it? Whichever priority you have, really understanding in that process, like, who, it will differ. Of course, like I explained, there are overall, your ambassador has a veto, like they can make the final decision where there's been no agreement, and you can run to them. You can use the chair to stop the discussions and make specific agenda items to address those things. They can also make a decision, really understanding, like I mentioned, that sometimes your Pepfar coordinator is powerful, sometimes they are not. You will really have to understand who really has the power based on the issue, that you really want to bring to the table. So you will really need to understand the power dynamics in the room, like who really has power and how things are moving within all these actors and stakeholders. Remember, I've just given you an example of leveraging Global Fund to push Pepfar to make a decision, and pushing Pepfar, leveraging the process to also make Global Fund make a decision in the room. So that's how it's all playing out. And very important that you do your thorough stakeholder mapping. You don't have to spend lots of time, but this you will see as you're going on. You guys are brilliant advocates, you know how to do advocacy. So, you will figure it out. These are the stakeholders. This is who is supporting us. You really at least need to have a clear sense of at the top, who is supporting our issue. between Global Fund, Pepfar, and even between Pepfar with all those different actors, who is supporting it, who you really need to know who's blocking it and likely to oppose you big time, because the ones that are supporting you, you just need to mobilize them to make sure that they continue to do that. But your biggest headache is going to be the one who is likely going to say no to that issue. And so the whole thing of what you're doing in those meetings and in the rooms is really figuring out, how are we going to convince this person? It can be an institution, it can be the government umbrella body wise, or it can be the director of the HIV, besides an organization in the room, but it can be one person that really is likely to block and stop the thing that you want to happen. What you're doing in these meetings is really trying to figure out who that person is that's going to block what you want to push for, and how are you going to navigate them and minimize their power in a way that it does not impact on what you want to get at the end of the process. So target who are the primary decision makers that really will make a decision about that particular topic. And remember, I have given you the broad sense of the layers of decision making, but sometimes it will change because there's politics and dynamics. So sometimes where you think it will be the Pepfar coordinator, sometimes it might not be. It might end up being somebody else that turns the decision in your favor, and you will have to figure it out during this process. So really having a sense of who are the primary decision makers, but also who are the influencers of that primary decision makers. This is advocacy 101. And then you do your stakeholder mapping and really figuring out who is at the top supporting your issue, who is on the other side opposing your issue, and who is on the other side, they have influence, but they just maybe are powerless. And so how are you also going to mobilize them and make sure that they give you some support? And where are you in all of this? So look at yourself as a red bubble, and I always use this power grid where you are positioning yourself as the red bubble, and you are targeting maybe a green bubble. On your right, you want to try to make sure that that person, that organization that you have identified has the answer to what you want to get out of the room. Like for me, I see advocacy as just moving through, the lines and tweaking and speaking to this one and touching this and doing this and saying this throughout the process in the agenda and interacting in a meaningful way that will get that green bubble, to make the decision that you are aligned and that you are, the same. You are thinking and seeing the same about the issue in a way that when you say we want you to expand from 43% viral load to 74, they actually agree. And when you break it down, this is what we want, they also actually agree and see that it's actually what needs to be done. So really understanding the primary targets and who's influencing them as well is very critical and very important, very, very important as well, to understand the power dynamics that are going on behind the scene. So that was just a bit of a detour, but I just wanted to bring us back into the advocacy mode, that as you're in this process, remember you're advocates. You're not just sitting there as we went to attend a meeting and this is what they were discussing and they were saying this and that. You are sitting there with an advocacy objective and you are really strategic. You're not just sitting there listening, to the meeting and then the meeting is over. So just a bit of a pause there. You have developed your civil society priorities. They're clear, they're smart. You now know who the actors are very well because we've spent a lot of time discussing them, the politics, the dynamics, how they interact. You have a good sense of here's what's going on, and but remember, all this is moving really fast. You don't have much time. You will not have like months and months, like sometimes in a day, like remember I said, you're going through a million slides and then you have to think about all these dynamics that are going on and the power, like it's becomes so overwhelming that before you know it, the process is over. So I think this preparation should give you a good sense of it's important to do some of this background work before you get there, because if you're going to wait until you are in those meetings, it's going to be over. But try to do as much preparation ahead, especially this putting together your priorities very well and understanding all the things that I've spoken about. So you now have your priorities, you have your understanding of who the actors and who your targets are. Now what? So I think this is where we're now going to go through the COP process step by step, and just taking you through it. But the biggest bulk of the preparation and the work, I think, is what we've just gone through. If you really do what we've just described and discussed, setting your priorities, really understanding the power dynamics and being very prepared, you will now find your walk through what we're going to discuss next very easy and very manageable. So remember, I mentioned that you're looking at the time frame from end of November to about mid-March, beginning of April, to completion. And in between, everything is happening so fast. So this is kind of like summary, mid-November to at least about April process is going on, of course, with the exception of the implementation, which starts in October, but this is what you should expect is going to be happening. So I want to start now going through each one of these processes and steps and just breaking it down briefly. Going back to the COP guidance. So the COP guidance is now getting longer and longer. It's about 700 pages plus these days. It started from a 200-page document overall, Pepfar HQ, giving a sense of direction to the country teams and everybody else in terms of here's how we are going to manage the COP process. So it's a very technical document. It's like instructional. But the good thing is that it also sets out like the priorities overall and sense of direction of Pepfar in the COP process in terms of largely technical considerations and what's new, what are they going to do differently, and how are they looking at specific issues and things. So very important document, but overwhelming to read and go through. But there's, again, global partners, Pepfar Watch partners, and other civil society organizations that are also digesting it and breaking it down in terms of priorities. So what's very important as young people to do, as we are recording this now, I think this is already a missed opportunity because it's mid-November to beginning of December, early January when it's finalized. But in that time, civil society already mobilized, they came together, they reviewed it, they looked at what is Pepfar prioritizing and what is it that they're not prioritizing and what is missing. And so you're gonna read it from the lens of here's what's missing or here's what they have said, but we don't agree this per se. We want them to change this narrative and language, and it should read like this. So this is basically what civil society are doing in response to this document. And civil society also tend to get themselves organized according to thematics. So there are those that are really just looking at what is Pepfar saying about prevention, and they analyze the document from the prevention perspective. And so you really need to plug into, especially the Pepfar Watch space, because that's where you will figure out which civil society are really interested in prevention and plug in. There will be civil society that are just looking at it from purely key populations lens. And so they will do a thorough review to say, what's new about key populations? What do we like about key populations in terms of what they're saying? What is it that we don't like? And they will critique and feedback. Like it's really, really broken down into technical considerations. And people are like critiquing it. Civil society, they join forces across the world to write letters to Pepfar to really engage and really give that feedback. There's also an opportunity these days, they made it easy that if you want to just feedback on a particular section, Pepfar always, when they release the document, they will make an online form available where you can read a particular section. So if you're young people, you're only interested in what is it saying about young KPs or just general HEYW or PrEP or anything, you can just read and go to the section. The easiest way I find is do a word search. You're not gonna like have 700 pages reading word by word. Do a word search. If you're interested in vaginal ring, that's your advocacy priority. Do a word search and go through the document and see what is it saying, and you take note of the page numbers, you take note of the language and the text, and if you agree, fine. If you don't, then you go to the form that they provide. You just simply put page number so and so. Here's what the Pepfar text is saying. Here's what I disagree, and here's what I want it to read and say. it's not wasted time. They do take it seriously. Some of those comments do get addressed, and some of those comments do get taken on board. So it's very important that you already are engaging in the process, because if some of the things are not quite clear and articulated in the COP guidance, it sets a very difficult tone for the rest of the COP process. Because if the COP guidance wasn't clear, sometimes Pepfar country team use it as an opportunity to say, oh, but Pepfar Washington doesn't agree on this, But when it's quite clearly articulated in the COP guidance, you have a backup. So that's how you technically engage with this document. It also gives you timelines in terms of what dates the meetings will be happening. And also there's a section in the COP guidance that talks about guidance from Pepfar HQ in terms of their expectations of how your Pepfar country coordinator should run this process and consultations, how they should engage with civil society and what they should do, and also what civil society can expect. And one of the useful things, which also thanks to civil society, because civil society pushed for it, and to make sure that it's very explicit, there's a section there where you will find a checklist, a table that asks the Pepfar country teams to say, in your engagement with civil society organizations, how many meetings did you have? They have to document that. What did civil society say? What documented input did civil society give to the process in terms of priorities? And what was Pepfar country level responses to what civil society raised? And this is where you will find that document is your ally and very useful, because if you go to Pepfar at country level and you've written down your civil society priorities that we've spoken about, and Pepfar responds by verbally, like I'm speaking, and they just say, yes, we're going to do that, and blah, 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 we have responded. Do not let it sleep. Do not accept that as good enough. You will say, but the COP guidance expects you to give us in writing a response of the things that we have asked for. Because why it's important for them to put it in writing, what we found before was they would ping pong us back. Is it a ping pong, like a tennis ball bounces back and forth? We would say, but we raised this. And the Pepfar coordinators, the Pepfar team, sometimes right in front of our eyes in these meetings would deny and say, no, civil society didn't raise that, or you did, but we responded and we told you this. But if it's not documented, you haven't written it down, you just look lost, and it's like you're lying, and they just put you in a corner and just just play you right in front of your face. So when we realized this as civil society, we were like, it makes a lot of sense that when we raise our issues, that's why I took a lot of time explaining how you best document your demands. Because when you document your demands in a very clear way, it makes it easy also for Pepfar to respond. And they better respond, yes, you are going to be negotiating and meeting and they will discuss, but ask them after the meeting to put it in writing. So that's opportunity number one in terms of engaging in the COP process. It's the COP guidance document. Next up, and also very important, is the COP planning letter. And this is happening now. Some countries have already received this last week. Some of them are still coming this week. They are trickling in. Again, I mentioned this is the letter that is coming from Pepfar HQ to the Pepfar country coordinator. They will copy the government. They will copy all stakeholders. Civil society are also supposed to get it. This planning letter is basically just saying, here's what as Pepfar HQ, we are concerned about the performance of the Pepfar program in Burundi, in Zimbabwe, in South Africa. Here's what we are excited about, that you guys are doing well. It will also say, here are some of the things that we really want you to put focus and pay attention. And then it will also say, here's how much money the country will have for this next COP season. And so the money varies. It's not static. It can reduce and increase from the previous years. It's not fixed. So it's very important to start with, how much money is available, and then, what are the priorities? What is Pepfar HQ concerned about, and what do they want the country to do more? And here's also another opportunity to look at that and review it and agree or not, and agree or not, but also have a sense of what is the government thinking about all of this? You know, do they agree to the Pepfar priorities? Because sometimes Pepfar can also be very pushy, you know. So sometimes government is also like really intimidated and they will just say yes, yes, yes. But I think that civil society is always then used as an ally also to say, okay, you know, we agree or we doing this and that. In the slides, the next one, I have given you an example. This one just came yesterday. It's an example of the planning letter for Zimbabwe for the current COP. It's also outlining, I've picked out a specific table. The letter is already very explicit, for example, that for PrEP, for AGYW and KPs, it's already given a specific amount of a figure, like, you know, this is the expectation that we want you to spend this amount of money on PrEP for these specific populations. So sometimes when you see these kind of planning letters, you go into the process. For example, here, let's see, it's about 6.3 million overall funding envelope for PrEP. When you go into the process, you see that overall funding envelope for PrEP has gone down to 4 million. I think it's also an opportunity to say, wait a minute, what happened? Because the planning letter had recommended this amount, so why have we reduced, you know, to lesser of an amount? Because remember, sometimes they will reduce and shift amounts of money to other programs as well. And where you will see for that specific population, they put less because they have taken the money and put it on something else. This is where these documents become useful, because you can always say, no, there was supposed to be this much money for this, and what's going on, and can we push it back to that limit? And even sometimes it always amazes me, and it's always exciting how much limits you can push. Trust me. We've had examples of asking for healthcare workers, and sometimes, like civil society, I think it's one question that you have, like, but how do we know? Like, how do I know it's 6 million that's needed? How do I know we need 10,000 healthcare workers? You have technical people. Reach out to global civil society. They will help you crunch the numbers. Sometimes, I really have to be honest, sometimes we are also lost. We're like, I don't know how you're going to calculate how many healthcare workers you would need to scale up viral load. We just come together and crunch the numbers. We know the facilities, we use them, we know, we like, okay, for now it's 2, it's not working, so let's just add 4, and then we do 2 plus 4, that gives us 6. So if we say we have 10 facilities in this district, we add 6 times 10 and we have a number, and then we just sometimes take a chance and say, let's push it further, because you want to push high, you want to be bolder in your ambition, so that when you fall down, when they reduce, they still reduce it in a way that you're comfortable to land and not drastically below your expectations. So that's just one thing that you are going to expect in the planning letter. In the planning letter as well, you will sometimes expect some minimum program requirements. For example, the adoption of implementation of test and start, rapid optimization of ART, there's the adoption and implementation of differentiated model service delivery, there is scale up of index testing and self-testing. There's so many other technical aspects of viral load on so many other technical topics. So this you will also find in your planning letter. And sometimes the planning letter and the COP guidance, they will be very specific that, you know, for country X, you have a problem with user fees. You know, we want you to address and ensure that you're not allowing clients who are accessing services in Pepfar sites to pay. And they will be very, very, you know, top line on that. So that's your COP guidance, that's your planning letter that you should be expecting now. And this is how you can engage with those documents and like respond and interact with them. And then next, I'm going to speak about now the in-country retreats and meetings. At this time, end of January, this is usually when these meetings are happening. I think for most countries, it's already going to be next week, beginning of February. There's a slight delay, I guess, but maybe you've already received invitations, or other civil society have received. And so you better be finding out, when is the country retreat meetings going to happen in our country? Which civil society representatives are going to attend? How are we going to engage them and coordinate with them to ensure that our issues are also around the table. Most importantly, how are you going to push yourself that you're also part of those consultations and that you're around the table and around the room and in those meetings as well? So in the in-country retreat meetings, it varies country by country. Some countries do it in 2 days, some countries do it in 3 days. So again, I have an example here for Zimbabwe. This is a real live agenda that came, I think, also a few days ago. I'm using Zimbabwe example a lot because I think that's where I have the most updated information that I've received this week. So their in-country retreat meeting starts on Monday, the 31st, and I think it's going to be about 4 days until Thursday, the 3rd of February. So for almost a week. So in the example, you have the chair, you have Global Fund already presenting on day one of the agenda. They will put the name of the Global Fund portfolio manager. And for example, on day one, she's just going to give the Global Fund portfolio summary for the country. And this year is supposed to expect in a lot of countries that there will be a standard presentation from Global Fund, really summarizing, here's our portfolio, here's where we are in the response, and also here's how our Global Fund program is aligning with the Pepfar program and like coordinating. And of course, there will be achievements that Global Fund has made in that year, and also maybe something on the COVID response and a few other things. On day one, you will also have the government also giving their own perspective. Here's our overview and summary of our own response in the country. Here's what the government we have achieved, really trying to impress, and take note also what the government is saying in response to the COP guidance and the planning letter. They will also do a quick budget overview. So they will give a budget overview of here's how much money the country will have, and also the summary of the priority technical considerations and issues that the country is really struggling with that need to be addressed in the current, COP year. And so, of course, on day one, very important for civil society. Civil society also have a space on the agenda, and it didn't come given to us. We fought for it. We said if government can be on the agenda, Global Fund can be on the agenda. We also want civil society to be on the agenda. Before, it used to be UNH speaking for us. We said, no, we have our own mouths. We know our issues. We want to be there. We want to speak. Do not wait until day 4. This is the time where, remember, you have developed your civil society priorities. You have understood the actors. This is the time you bring that list. Be organized. Do not just ask somebody to speak. Do not. Put it in a PowerPoint presentation and say, point priority number 1, with all that we've discussed, the framing. This is what as civil society we are expecting. Begin to lay it out already. So make sure that you have put it in a PowerPoint presentation. It's well done. It's well written. Whoever you're going to choose to present for you presents it. And already make sure that Pepfar responds already. And like they will say something in the meeting and say, great, thank you so much. And those are very good priorities. We are thinking XYZ. Yes, we agree with you. That is what we are going to do, blah, blah, blah. They will tend to give general verbal responses. But this is where you begin to take action. After that meeting, send the PowerPoint slide to the Pepfar coordinator and say, here's our PowerPoint presentation from civil society. We would like you to begin to respond word by word to the priorities that we have raised, whether it's a yes or no, and if it's a no, why not? Because now you're setting a tone for engagement. Pepfar is already clear on what you want. And as you go throughout the process, it's about fighting for the things that Pepfar is not very explicit. You're pushing for clarity. You're pushing for, you said yes, but you're only giving us 5 million, but we want 10 million. And so you are now beginning to push. And so moving along the agenda, day 2, it differs, but it looks at the treatment cascade, basically, of HIV. Like, you're looking at your prevention, testing, linkage, and support, blah, 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 and then all the other supporting things like HR, data, M&E, research, and all the other pieces. And remember, we spoke about Pepfar implementing partners. How are the partners performing and the differences between the performance? How is Vialload developing? What are the challenges in drug supply, accessing ARVs and the budgets? Do we have enough? Is there enough money? What about pediatrics? What's going on? What needs to be adjusted? How is our robust data monitoring? What about human resources for health? Do we have enough? Are they sufficient? What are the current, stockouts projected as well? And, all those things they will look at, and they will look at, the minimum program requirement. How is the government performing on those? Have they met them? Are they planning to meet them? What about the funding, the sustainability? What is government really coming to the table with? There will be and also like an overview of the HIV context, like landscape and just other political issues in country that might impact the response. And now, of course, we have COVID. They will discuss how are we mitigating the impact of COVID on HIV. And then, of course, civil society-led monitoring. They will discuss any other plans. And that's like your full 4 days. It can be like in 1 hour, you're going through 60 slides of data, of information, and then you take a 5-minute break, and then you start again with another 20 slides or 50 or 100. And then it's like that the whole day. So that's what you're running through. And that's why important already on day one, civil society have a slot, make your case known. If you're attending virtually, sit in one room, because have a WhatsApp group if you're not, because then as they're presenting, one of you is on high alert and you're like sharing and you're saying, I don't understand that question, or can you ask that question? And you're reaching out to global partners to say, they just say this, we don't agree, how can we push back? Like, have a system of either you're in one room and you're strategizing and quickly talking and saying, no, we're going to push back, we're going to do this, and you're really well coordinated. If you're physically there, make sure you're sitting next to each other and you have notebooks in front of you, because sometimes you can't be whispering and talking, but you're passing notes and saying, I don't agree, can you raise that question? Or I'm going to ask this question, can you back me up? This is how we are doing the whole time. And so when you're not alone, you're working together like this, it makes the work easier and lighter because you're holding each other's hands. We also very strategic where it's virtual. There's consistently somebody responding to all the questions in the chat box. Sometimes they will pretend, especially if it's a question they don't want to answer, they will pretend they didn't see it, but they did. They usually spend about a few weeks, maybe 2-3 weeks in between to begin to consolidate all the comments and all the issues. And in that time, they are communicating with Pepfar HQ to say, okay, we held our in-country retreat and this was the outcome and this is what came out. And so they're interacting with the country chairs in Washington. This is the time that you, civil society, are not just sitting and waiting for the next invitation to the next meeting. What are you going to do in between the in-country retreat to the next meeting? You're going to be meeting as civil society, whether virtually or in person, strategizing and saying, okay, we presented our priorities. What has been the response? What has been the feedback? You are now also beginning to unpack and writing them up and putting more meat and bringing more arguments and being more savvy. Like, okay, this we are getting ahead. This we are not. This is going to get tough. How are we going to tackle it? You're using that time to consult more widely, to build consensus, to consolidate. You're using that time also to meet with the Pepfar stakeholders at country level, the technical team, the agencies, USAID, CDC. You're also using that time to reach out to Pepfar HQ if there are things that you're still not clear on, you're asking questions, you're interacting, you're having meetings. You will need to be lobbying with global civil society and coordinating. So in between the country retreat meeting and the next process, you are not just sitting. There's a lot of work. So after the in-country retreat meetings, also known as the country planning meetings, the next step is the regional management meeting. What I've done is just to give you an overview of the key dates because they are happening at different dates and times. The meetings will start on the 7th of March with what you will call Group 1. These are just a specific list of countries like Nigeria, Rwanda, Mozambique. Of course, the following week will be another group of countries. So the regional planning meetings are similar to the country planning meetings. It's just that the regional ones are now broader. So there's also, in addition to country level civil society, country level WHO, UNAIDS, Global Fund, Ministries of Health, there's also an country level Pepfar, USAID, CDC. There's now, remember, the global actors that I described before. So you will have their regional WHO, global Geneva-based WHO people, You will have the country portfolio managers from Geneva. You will have also UNAIDS from Geneva. You will have Pepfar from Washington, DC. You will have global civil society. So it's a bringing together of regional, global, and national stakeholders in all these stakeholder agencies and organizations that I described to really make the final decisions. So this is a very important meeting. They are not starting to make decisions here because remember, your in-country retreat is where they're already beginning to make decisions. The planning letter is already where they're beginning to make decisions. So see the regional management meetings, because sometimes civil society tend to think, oh, we are relaxed and then we're just going to engage at the regional management meeting. Too late. This time around, they are now sealing and consolidating on their decisions and just making sure that everybody's around the table when that is being done. But at this time, they already have decided on budgets. They already have decided on program interventions. They've already have laid out quite a lot and they have far moved ahead that if you wait until now, it's going to be hard. But again, it's a very good opportunity to get a sense of where they are in that planning and in the sense of direction that they have and where they are going and really still push back. This is the time that between end of January and at least mid-February that you really have made sure that you have engaged as much as possible so that when you go to the regional management meetings, you're actually just clarifying and fighting over, like we discussed this, you said this, we're still not convinced. Can you still bring more clarity? You're not using that as a starting point, but rather a refining, tackling point of still trying to win your demands. So that's the regional management meetings, very decisional, but already very advanced in the decision-making spaces that you don't want to wait, but you really want to make sure that you've been heard, you've engaged robustly before that. After the regional planning meetings comes the approval. This happens usually a few weeks, sometimes very much closely after the regional management meetings, but it can take 2-3 weeks in between. They will have a short approval meeting. It can be one day or one afternoon where they will now do a one-slide presentation that gives an overview of since January, this is what we've discussed, we're going to do, and this is what we've agreed, and this is the budgets. And so this is just a final meeting to say, we are now approving the COP for this country. Is everybody okay with it? And are we fine? So when we used to meet in person, this also used to happen at the last day of the regional management meetings. The COP would already be approved, but nowadays they're putting sometimes some days, and maybe it might be a couple of days or weeks in between, where they will now approve the COP. But when it was just on the last day of the regional management meetings, and remember the ambassador will be there and all these grand people that look intimidating, it was always exciting sometimes. And the ambassador, like this is also a place where civil society will be asked to make a short presentation and speech to see how we have been engaged. And you can say, they ignored us. You know, civil society, sometimes we are fun. This is the time when we will say, oh, but ambassador, they completely ignored us. We had a tough time and we actually don't agree to this scope. Like, you're not going to say it like that. But if you feel that's how you were treated, this is also the moment to say, we were not robustly consulted and we're not happy. Like, we just don't think this is worth like passing. And it's in a few instances, I think if I remember in the past 10 years, there's been instances where Mozambique COP didn't move ahead because it was crap, and civil society and others as well felt the ambassador also said, this is not good enough, go back and start planning again. I think Nigeria, there's been a few countries where the COP process was halted a bit because it's okay to say we are not happy, you know? We are not happy. And sometimes, of course, we say we are just fine with it. Let's go ahead because you also don't want to stop things and just move things forward. But just remember that this is also your moment to shine and have your voice and say what you really feel and what's really important in terms of your experiences with that process. So ultimately, for me, I think the key thing is remembering that it's not a complete COP process until you see the budgets translated and changing. So if you were asking for PrEP expansion, and you see that the budget for PrEP is still the same, hardly that should give you a warning bell, because like, how are they going to expand without additional resources, So it's already just ringing a bell that there's something missing. And so really make sure that at the end of the COP process itself, especially at the end of the regional management meetings, ask about insights into, there's a tool that we call the FAST tool. We will share this also as examples. That shows you, like, here's the budgets allocated for specific programs. If you look at that on day one of the regional management meetings and maybe day 3, you really want to see that there's a shift. Because if things are still the same in terms of budgets, in terms of what they were in day 1 and day 3, you really have to wonder, like, how are they going to make those adjustments? It's possible that maybe they've found efficient ways of doing it, and so it's going to cost less money. But for what I know, most of the times, you will also mean additional resources in order to expand on some of those ambitions. So make sure that you also ask it for the FAST tool. Usually they don't give it to you. And usually it's also like, it's not very open, but we always find ways as civil society to find it, to really get an insight in terms of, if they can't share the tool itself, but at least ask them to summarize it in a PowerPoint slide, like, here's what the budget lines look like before, and here's what they look like, because then you can be feeling more comfortable that they actually have made some changes. Because after this, the next thing is now the writing up of the strategic summary direction document. This is now the document. It's usually 60, 70 pages, maybe 100 pages for some countries, where they will begin to summarize what they have discussed and agreed from January up until the approval. They just want to put it in a document, and then it gets sent to Washington, it's signed, and then it's ready for implementation in October. So you don't stop. As civil society, we are saying from day one, when they begin to write this strategic summary document, we want to make sure that we are reviewing it. We want to make sure that the language, remember all those written feedback and what Pepfar said they would do, and the language you asked and how you formulated it. You want to make sure that in the SDS, how you formulated your ask is reflected exactly the same in the SDS, because they are very smart. They will go and twist the language and change it, and then it completely means something different. So really make sure that the language you developed, you worded your exact specific demands and priorities that we explained, that it's worded exactly as you have shaped it as civil society, as you wanted in the SDS, because the nuances could mean a lot of changes and impact. So this is just the final document that now summarizes the country context, the epidemiological profile, the activities, the approaches, the budgets, everything that, the program support interventions that Pepfar is going to do. And so your core thing is making sure that you're reviewing this. And again, you're sending inputs in writing. So there's tools that we've developed that just gives you a quick, rapid page 1. The SDS says this, we want it to read like this. Page 2, it says this, we want it to read like this. There's all those tools available that will be shared. And so up until you continue fighting to make sure that those changes are being adjusted, you're still having meetings now with Pepfar at country level, until a point where you're like satisfied that, you may not get 100% of what you're asking for, but at least aim for 85, at least aim for 80. And then you can say, okay, we've fought a good fight. We've tried our best. I think the rest of it we can compromise, even though we are sulking and we are not happy, but, at least we've pushed hard. So that brings us to the end of the COP process. We've engaged in all key documents practically up to the end with the final SDS that usually for a lot of countries is finalized end of April, and then it's submitted to the Congress waiting for appropriation and approval. Nothing happens after that. If you've missed this process, forget it. The rest is implementation and monitoring. So you're not going to come to the process in June expecting to influence and change anything much. At that point, it's just about reviewing data and performance and following and monitoring what's going on until the process starts again in the next year, November time, with the COP guidance. So I've taken you through the full cycle. Maybe we want to wrap up with just some tips and tricks. Remember to use your advocacy tactics. Remember your advocates. You guys are brilliant, skilled advocates. Put the advocate hat on come to the table with predefined objectives of what you want to mean. Just don't go because you've been invited to meetings and you're going to attend without clearly, this is what we want to get out of it. Know your stakeholders very well, how they interact, the politics and the dynamics, and who's making decisions and the power that is lying there. Very important to know which are the real targets to push, how you're going to nail them, what tactics. If they ignore you in the meetings, what are you going to do outside of the meetings? How are you going to follow up? Use letters, use emails, send lots of emails to Pepfar at country level, to Pepfar HQ, copy, liaise, and collaborate with global civil society as well. Data is key. We spoke about CLM data, we spoke about Pepfar data, we spoke about your experiences and your observations in terms of what you're seeing, really making sure that you have put very articulate, well-written civil society demands and priority. Sometimes we also have to be a little bit nasty and really just throw tantrums there. It works. There will be times when you will have to be very quiet and diplomatic and negotiate. You will do a lot of negotiation. There will be times when you have to press the button hard and not compromise and push until you get what you want. Earlier in the process, the better, to make sure that you really press hard and that you are very clear in the responses that you get. Speak up, raise your hand, coordinate, like I said, strategize who's going to raise question 1, question 2, how are they going to do it, how are we all going to support. Make sure you check in with the Pepfar chair and the coordinator, even if it's just for 15 to 30 minutes, to say, these are our expectations. At the end of the process, say, we were happy with this, we're not happy with this, can we follow up? Really securing yourself time and pushing on the agenda to make sure that they create time for you is also going to help you win faster than just waiting for when the issue comes up. I think some of the agendas that we've shown on the slides, you will see that some of the things will not come up on the agenda at all. They will not pop up. So you will have to carve and create time for those things to be discussed. And like I said, don't wait only to be invited to meetings. Create your own meetings and invite them. Use your allies. Sometimes they'll be your allies, sometimes maybe your opponents, but leverage on WHO, Global Fund, UNAIDS, sometimes the government, but also other civil society, global and national, to really support you and campaign. It's like, it's a tactic, campaign. Do not be intimidated. You are the experts. Own the space, you know. It's not a science, it's not an art, it's a fluid process. You will have the hang of it as you go through. Be very agile and flexible. And it's going to be long hours. It's going to be exhausting data. I get headaches, so many slides, and it's like, wow, I don't understand, but keep pushing. Be very strategic, prioritize, be bold, negotiate, build consensus, fight, and just do everything. I've spoken about speaking the Pepfar language, very important. I really want to emphasize every other communication feedback, put it in writing. It's going to save you, and it's going to be exciting at the end of the day to see how you have evolved and say, we started asking this, it wasn't clear, we actually got this, and you can document it as your advocacy win. There's multiple layers and entry points for engagement. We spoke about what's going on at the country level. Your HQ team is not out of reach. You can email them, you can request for calls and meetings with them. We've spoken about using Global Fund and UNAIDS and WHO and other players and actors to support you, but also as entry points of advocacy, and sometimes to leverage them, sometimes to also get them to do something, like in the examples that I gave, collaboration and consultation and coordination with other civil society. And my last point is own the space. You are the expert.